Hi, everybody. This is Vamshi Rao. I'm a pediatric neuromuscular neurologist at the Ann and Robert H. Lurie Children's Hospital of Chicago. And I am joined by Dr. Gary Noritz. Dr. Noritz, go ahead.
Hi, I'm Gary Noritz. I'm an internist and pediatrician at Nationwide Children's Hospital and The Ohio State University. And I work in a clinic that takes primary care of children and adults with disabilities.
Dr. Noritz, it's a pleasure to have you because this topic is very central to what you do. So I really wanted to get your insight on the role of a primary care physician, whoever that may be, in terms of their training in managing individuals with Duchenne muscular dystrophy.
Yeah, I mean, this is the kind of thing that I spend really most of my career on, not just muscular dystrophy, but other kinds of disabilities. The thing about children with muscular dystrophy or children with any other disability is that they're children first. And something like 99% of being a primary care doctor for a person with Duchenne muscular dystrophy is being a primary care doctor. And all the kids with Duchenne muscular dystrophy need all the same things that any other child does. They need immunizations. They need anticipatory guidance. They need screening for various diseases, hearing loss, vision loss, lead poisoning. Um, and they really, we really should be functioning as the medical home, that first point of contact that the family will go to when the child is having a problem or they have a question, whether that's they think related to the muscular dystrophy or not. And there's a few reasons for that. And one is that the primary care doctor in the medical home setting should have the ability to see a child pretty quickly as an urgent visit or a phone visit or a telemedicine visit. And often really doesn't need to send them on to the specialist because so much of the things that are going to happen, especially early in life, are general pediatric kinds of things. There are going to be ear infections. There are going to be rashes. There are going to be stomach upsets. There are going to be school problems. And these are all the things that primary care doctors do day in and day out and really are quite excellent at. We really need to closely work with the specialists, but they don't need to be involved at sort of every step of the way. And the family shouldn't feel like they need to call a neurologist every time the child is complaining that they have a sore throat. That's really something that the primary care doctor should be able to do. From your end of things, how do you best work with primary care folks once the patients get back to you?
Yeah, actually, it's key to have a partner in the primary care physician when we work with a family that is dealing with Duchenne muscular dystrophy. I think, as you alluded to, we think of the child's medical home being with the primary care physician. Although we have a multidisciplinary team, it's really geared towards uh, the specific Duchenne muscular dystrophy part of the child. But like you said, a child is a child, and they're not defined by their Duchenne muscular dystrophy. They're not just Duchenne muscular dystrophy. They're children with other healthcare needs. So I think the partnership really goes back and forth quite a bit in terms of making sure that a child who has a question that needs to be dealt with by the primary care physician goes to the primary care physician. The primary care physician alerts us if that condition could interfere with the underlying Duchenne muscular dystrophy. And the other way around, if you find that the child has something that is could seem benign, but it could change the child's underlying Duchenne muscular dystrophy, then you let us know. So I think it sort of completes the circle, so to speak, in terms of this sort of a group of people around the child and the family. Another really, really important thing that I find where the primary care physician partners so well is there's only so much in terms of education and resources that the multidisciplinary team can provide in a short period of time that the child is with them. But the primary care physician has way more time in terms of the number of appointments or the number of times the child is seen by the primary care physician. So sometimes the education is reiterated or reinforced, and sometimes there is absolutely new education that the primary care physician is providing. So I would say in conclusion that it's a great partnership between the multidisciplinary team and the primary care physician.
Yeah, the primary care doctor probably doesn't have a lot of experience with Duchenne muscular dystrophy, and this may well be the first patient they've ever had, or maybe since residency anyway, who had muscular dystrophy. And so, as primary care doctors, we need to learn about the things that our patients have and the medicines that they're taking. And so, when I think about sort of the pitfalls that a primary care doctor really needs to be aware of, uh, having to do with the muscular dystrophy, it seems to me that there's a few that are really important. And one is knowing if and how much and what to do with a patient who's taking high doses of corticosteroids, because they can be adrenally suppressed. And there can be problems if they get sick or have a fever or something like that. And we need to know about the potential for respiratory problems and cardiac problems. And they often will happen eventually, but the first signs of them may come to us in the primary care office, and we need to recognize, oh, this could be that thing that we think happens down the road in Duchenne muscular dystrophy. Assess it, do the testing that we need to do, and really be in discussion with the specialty team about what to do next.